Dear viewers, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Health Check. My name's Dr. Sekikubo Musa, specialist obstetrician gynecologist, to present the program. And with me in the studios is Mr. Mpiima, Jamil. Today's topic of discussion is diabetes mellitus and the nutritional bit of diabetes mellitus. By way of definition, diabetes is characterized by abnormally high saturating levels of glucose, and this can damage the tissues where the blood is passing, where we're having high levels of glucose, and can also, in extent, damage other essential organs like the heart and the kidneys. Why do we talk about diabetes mellitus? Is it a problem in Africa? We are seeing a doubling of the prevalence of diabetes mellitus among the young people in an African setting. And yet we know its treatment is long-term. Diabetes mellitus is classified into two types, type 1 diabetes and type 2 diabetes. Type 1 diabetes is where the individual relies solely on exogenous insulin, where the body produces little or no insulin to manage or to control the blood glucose. On the other hand, type 2 diabetes is where the body produces some insulin, but not enough to regulate the circulating glucose levels. That's where we are starting from. Who is at risk of getting type 2 diabetes mellitus? Those who have overweight or those who are obese at an increased risk of getting type 2 diabetes mellitus. Mr. Mpiima, how can you advise our patients or our population on preventing or managing diabetes mellitus, the nutritional component of diabetes mellitus?
Yes. Thank you, Doctor, for that question. Yeah. As you have hinted, the burden is really very big. And we are seeing that about 7 million people in Africa, approximately, the World Health Organization says there could be about 7 million people who are having diabetes in Africa. And diabetes as a disease is, especially type 2 diabetes, is a lifestyle condition. By a lifestyle means the cause is based on what you eat and the way you live your life. Yes. So the way we can manage diabetes is that solely there is medication, there is that bit of medication, and also the biggest part, which is the nutrition. So the nutrition is something which is very easy to do. As one time we talked about a balanced diet.
Okay.
So when you talk about diabetes, there is nothing like a diabetes diet. If you have diabetes, it doesn't mean that your life has ended, that you are going to stop eating anything good. You are stopping to eat all foods. You eat only one type of food. It's not the case.
Okay.
So basically in diabetes, what we look at is what to eat, how much to eat, and when to eat, depending on the type of diabetes you have.
Yeah, I would rather that we mainly look at the type of diabetes that is insulin dependent. Yes. That is non-insulin dependent.
Yes.
I mean the type where the body is producing some insulin,
yes,
to regulate the amount of glucose in the circulation.
Yes.
But it's not enough to have normal levels of circulating glucose.
Yes.
So that is the one we have termed as a lifestyle disease.
Yes.
So how can we help this particular individual who finds himself in a dilemma of producing insulin but not enough to manage the circulating glucose levels?
Yes. So thank you. In such a situation, we find that such an individual will be on treatment.
Yeah.
And solely the treatment is usually they get some external source of insulin or medication which is helping them to bring down the sugar. And as we know that sugar in the body is from food. Not only the table sugar we add to our tea, but also from the other food sources, mainly the energy-giving foods. So these energy-giving foods are ever complex. They are like, for example, if you take rice, it will reach the body and that rice is broken down into sugar, to just simplify it that way. So, meaning, as I've mentioned earlier, that what we consider in a diabetic meal plan is what to eat, how much to eat, and when to eat. So the question of what to eat is that someone who's having such a condition out there or needs to know what are those food sources which are having sugar in them naturally.
Does it mean that you are going to, if you're found to have diabetes mellitus,
Yes.
are you going to be exclusively eating non-sugar containing foods? Like I will stop eating my yam, I stop eating my cassava, I stop eating my potatoes, and so that I can prevent myself from getting abnormally high levels of insulin, of glucose?
That's not the case.
Okay.
Because the body still needs the sugar.
Yep.
So what we are looking at is how to be able to moderate the portions of such foods so that they don't raise the sugar levels so high. Since our body, such a person, the body is already impaired and the body can't, is not able to bring down the sugar by itself. Okay. It is relying from an external source. Meaning that such a person is supposed to see a way of moderating the amount of food which has sugar in them to see that it matches the kind of medication they are taking. Okay. Someone who's taking insulin can be able to modify, because insulin literally brings down the sugar.
Yes, it does.
So that means that they can even be able to even eat a relatively large amounts of such foods. For example, if someone is 15 years old and is a footballer who needs a lot of energy to be able to run around, so such a person, then that means that energy is supposed to be got from the food. Okay. So that person will be able to adjust the amount of food they are taking and also adjust the kind of insulin they are taking.
That they're using.
Yes. Okay. So that insulin matches the kind of food they are eating. So when we look at what to eat, basically we look at three kinds of foods. The energy-giving foods, which we talked about, which are staples. Okay. On top of those, we add the fruits. The fruits also are a source of natural sugar. Okay. Then there are things like milk, which also has sugar in it. Okay. Then on that, in the energy-giving foods, to break it down, there are the staples. There is the table sugar, which we add in our tea. And other foods like sweets and other candy, which we normally buy, and they have sugar in them. So those are the foods mainly to look out, especially if someone is producing little or no insulin, which is not enough to bring down the blood glucose. Okay. Yes.
What would you advise such a patient? Because I'm looking at a situation where someone has reduced the volume, yes, for example, of the energy-giving foods that they're eating, yes, increased the body builders, yes, the proteins, yes, and increased possibly the fruit component. Yes. How can they, do they have some of the energy-giving foods at some meal and then maybe have proteins at another meal in the larger quantities compared?
Yes. So thank you. The concept of the balanced diet still applies. Okay. Is that we need the energy-giving foods, we need the body-building foods, and we also need the protective foods. However, in such a situation, what differs is the amount of the energy-giving foods. Because now these are the foods which are bringing up the spike in the blood sugar levels, especially when someone has an impaired production of insulin. Okay. So now it's the portion, meaning every meal they will have a portion of the energy-giving foods, but it will be smaller compared to someone who is normal. Or it may be higher depending on the amount of insulin they are taking. Okay. So a diabetes diet is not something limiting, that you try to take away these foods and bring in these. No. Okay. Yeah. It shouldn't be the case that we are withdrawing away the energy-giving foods because any human being
still requires
needs the energy.
Is it important to have a diabetic diet, to have some caution if someone is real diabetic? Is it super essential that they have some alteration in their diet? Why is it that important?
Yes, it's very important. Diabetes being a disease which is managed by food, or which is brought about by food, or even when someone is not able to produce insulin, that insulin works on food. So it is very important. The first point for the reason to alter the diet of someone who is diabetic is that we want them to have also normal levels.
Okay.
Because as you mentioned in the introduction that someone who has diabetes, there are some complications if that diabetes is not well managed. So we need to have good numbers. We need the sugar levels to be low. We need the cholesterol to be managed. We need the high blood pressure to be managed. Secondly, we also need these food is there to be enjoyed. So basically, even when you are diabetic, you need to enjoy food despite your condition. So we look at planning the meal of a diabetic so that if each and every individual, even if you're diabetic, you still enjoy your food. Then a third reason would be that some people who are diabetic are still young and they are growing. Some people, or even the ladies, she can be pregnant, but she has diabetes. And such processes need a lot of energy, which energy is coming from these foods, which are also leading to the complication because the energy-giving foods are the ones which are raising the sugar levels. So we look at modifying their diet a bit to suit their particular needs.
Great. So it's therefore important that whereas someone who has diabetes may get additional medication like insulin or drugs that lower the circulating glucose levels, but they still need to look out in their diets so that they support the medication that they are getting to manage their condition.
Yes.
And we also agree that long-term, it's important that overall, normal levels of saturating glucose are essential in one's health because high levels are associated with damage to the blood vessels, which makes them stiff eventually, and someone may develop hypertension on top of the diabetes problem that they have. So we have seen that it's really important that someone, when they have diabetes, they should actually have some nutritional support so that they support the medication to help them achieve normal saturating levels of glucose. So what do we, apart from the diet, is there anything else that these people can do to manage their condition?
Thank you. As we have said that the diet or the meal plan is the biggest component. But as we introduced, is that diabetes is basically lifestyle. There are other things. There is the way we live our lives. Diet is just a component of the lifestyle. So meaning the other things, if you have diabetes, you should do to live a happy life. To also avoid attacks like where the sugar levels rise so high or so low, which wouldn't be good for such an individual. So one of them is try and exercise. So the exercise is important in such a way that whenever you exercise, the body tries to pull out that excess sugar to use it for energy. And also in such a way that it makes your system efficient. That even when the insulin is so little, it makes it efficient to be able to work in the body. The second point is to, for a diabetic person, is self-management. So each and every diabetic person at least should have a machine to be able to test. Because there will be times when there are highs and lows in the sugar levels. So you should be able to know without waiting for the doctor. Because maybe you could be doing an activity and maybe you forgot to eat, or you ate so little, but you don't know, or you
Okay.
forgot, and you start feeling differently. So testing helps you know, now I'm low on sugars, I need to take something, or the sugar levels is so high, I need to adjust my next dose. Yes. And the other thing is to, there are these behaviors which also increase the risk of the sugar levels rising. Things to do with consumption of alcohol, smoking. Such things may not directly influence the insulin levels or the diabetes, but they influence our behaviors. In that you may do such things, and then your appetite either goes down or
You
goes
forget
so
to
high.
eat, and
Yes.
and then
Or you forget even to take your medication.
Okay.
And you get serious dilemma, which even needs hospitalization.
Okay.
Yes.
So in a nutshell, it's not like medication alone will not solve the problem of diabetes.
Yes.
We also have to look at the way we live. I mean, the way we live includes what we eat, how much of which we eat,
Yes.
being regular on the medication that we take, and manage ourselves. Because diabetes, yes, it's a lifestyle disease, but it does not mean that you are dead. You are still
Yes.
alive, and you have to live your full life.
Yes.
Oh, thank you very much. So how else can we prevent it from actually occurring in our communities? Because we are seeing the number of people getting diabetes in Africa is actually increasing, but how can we prevent it from occurring?
Yes. As you introduced that diabetes is in types.
Yeah.
Type 1, unfortunately, is in most cases people are born with it.
Okay.
Or they get a condition and their body just can't produce insulin. But then when you look at type 2, it's basically comes from the lifestyle we live. Type 2 diabetes is highly associated with the weight of the individual.
Okay.
And it has been proven beyond reasonable doubt that people who are overweight have very high chances of becoming diabetic or developing type 2 diabetes.
Okay.
Meaning, whenever you follow a balanced diet and maintain your BMI in the normal range, meaning you are not heavy for your height, you reduce your chances of developing diabetes mellitus type 2.
Okay.
So one of the preventive measures is by controlling the weight.
Okay.
And controlling the weight means following a balanced diet. Balanced diet literally means variety.
Okay.
And also doing some little activity. Activity is activity. Walking, running, jogging, digging. Any activity is activity.
Okay.
And the other point is doing health checkups here and there. Because some of these diseases, they come when we don't know. It can come and it can be arrested early, and they tell you you are tending towards diabetes. You can do this and this, or you can do your nutrition and change your nutrition and do a balanced diet, and minimize your risk of developing the diabetes. So doing health checkups at least once a year. It helps a lot in preventing the diabetes because it can be seen early and interventions are put in place.
Okay.
Yes.
So it is a combination of our lifestyle.
Yes.
And lifestyle means that how much do you do physical exercises?
Yes.
Get to know your weight and your height,
Yes.
so that we can measure or know your body mass index, abbreviated as BMI.
Yes.
And the BMI above 25, get concerned. I think that should be the message to the individuals, that if your BMI is above 25, get concerned. And BMI is not, it's not very difficult to calculate. I mean, mobile phones can do it, but it's weight in kilograms divided by the square of your height in meters. And if your BMI is above 25, you need to get to work on it so that you remain within the normal range, which is between 20 and 25.
Exactly.
Part of if you find yourself in a situation that you have type 2 diabetes, then your advice is that we should watch our diet.
Yes.
But apart from that, if we are on medication, we must be taking the medication regularly. And also change our lifestyle to do physical exercises so that we can match with the treatment, support the treatment to help us in regulating the blood glucose concentration.
Yes.
Are there complications if someone had long-term high saturating levels of glucose in the body?
Yes, definitely there are complications.
Yeah.
The reason why we are fighting all this to try and see that we modify our diets and be consistent on the medication when you have diabetes is that it has lots of complications. The first one, which is the commonest, is erectile dysfunction in men. That we have seen so many men even complain before even they know that they are diabetic, that their energy levels in the bedroom have decreased, and they are trying to find all these solutions, but then the root cause is diabetes, which is not even yet diagnosed. So erectile dysfunction is one of them, and it has caused lots of problems to so many families because maybe they are not aware that it's a problem. There's also a problem that when you have unmanaged diabetes, you can easily get your limb amputated, what is normally called the diabetic foot. In a situation whereby the blood sugar levels start damaging the nerves, the feet stop feeling, or any limbs, they stop feeling.
Okay.
There is always that example whereby they give that someone had a needle pierced them in the foot, and then they took a plane to France and they hadn't realized.
Okay.
So you can imagine such a situation that the foot or the limb stops feeling. You stop feeling pain, you can't feel anything piercing you. Yeah, so in such an extreme case, the limb is usually cut off. And also, there are higher chances of someone who's diabetic to develop things like stroke.
Okay.
Yeah, and when you look at also the mothers who are pregnant, they can easily get pregnancy complications when they have gestational diabetes. Okay. Yes, the complications are really so many.
Overall, we can say that with diabetes mellitus, when you have long-term poor control of the saturating blood sugar levels, you are at increased risk of damaging the inner lining of the blood vessels. And some of these blood vessels will be supplying very vital organs. Like the eye, diabetes can lead to blindness. Like if you have decreased capacity of the blood vessels to supply blood to the brain, someone can get a cardiovascular accident. If you have little blood going through the heart, you can get a heart attack. If you have little blood going through the nerves can be damaged and you lose your sensation. And because the blood vessels are becoming thinner, the pressure against that is required to pump blood through them increases, and most of the diabetics can actually end up getting hypertension. And then you have a dual tragedy. The hypertension is a long-term, a lifelong illness, and even diabetes is a lifelong illness. So overall, it's not like it's not a least important condition. It's an extremely important condition because long-term poor control can lead to complications like blindness, can lead to complications like stroke, can lead to complications like heart attacks and stuff. So it's really important that our viewers take it as a serious matter to look out to check whether they have high levels of glucose or their BMI regularly, can exercise and see how their weights are doing, and change their lifestyle fitting a health lifestyle. What can we give as a take-home message?
Yes. My take-home message to our dear viewers is that when you have diabetes, there is no need to panic. Just go and seek help from a professional. Discuss your diet. What we are giving here is the general recommendation.
Okay.
But you need something personalized to you as an individual because we are all different and we live different lives. So seek out help from a professional, and also know that the diabetes meal plan is something very easy. Just to look out for those problematic foods and try to take them in moderation according to the kind of medication you are taking.
Okay.
Yes, thank you.
Thank you very much for all the information that you have given our viewers. We have a problem in Africa that the number of people who are having type 2 diabetes is increasing, and we have defined that as high saturating levels of glucose in the blood. And it's not without complications. Amongst the most important complications are they will compromise your saturation to the vital organs. And among the complications are things like getting blind, having strokes, or having even our limbs amputated because the sensation in those areas has been lost. However, importantly, everyone should check out well in advance whether their BMI is normal. The normal BMI is between 20 and 25. And BMI is your weight in kilograms divided by the square of the height in meters. If you have an abnormal BMI, consult your nearest physician to see how you can get back your BMI to the normal range. If you check regularly to see whether you have high levels of saturating glucose, still consult the physician to see how you can manage that particular condition. Dear viewers, it's been me, your presenter, Dr. Musa Sekikubo, specialist obstetrician gynecologist. All this information and more is available on live streaming on www.mta.tv. It's been a pleasure meeting you. Thank you very much.